Hi everybody. Today is World Anesthesia Day. Today me and my colleagues from Apollo Hospital are going to give you a little insight into anesthesia.
Today is October 16th, which world celebrates for Anesthesia Day. It was first tried anesthesia for a patient for a dental extraction. Today I'm here to talk about anesthesia. Anesthesia is a specialty of itself which facilitates the surgeon to do surgery for a patient, and then patient is pain-free and is comfortable. So this is what anesthesia in a broad category. Anesthesia, generally we use multiple drugs called anesthetics to block the pain and prevent the feeling sensation during medical procedure. There are basically three main types of anesthesia. One is general anesthesia, second one is the regional anesthesia, and third is the local anesthesia. Everything has its own pros and cons. Okay, general anesthesia generally which cause a state of deep sleep where the patient are unconscious and unaware of what's going on. Regional anesthesia which numbs the larger part of the body like arm and leg. And local anesthesia is an injection given at the site of surgery, specific site of surgery. So this is what is a broad differentiation of general, regional and local anesthesia. So anesthesia is again a triad which is hypnosis, make the patient sleep, analgesia and reflex suppression. So now if you coin everything and define anesthesia, anesthesiology is a science where you attain this triad with not a single drug. We use multiple pharmacological agents, and now we are going to use with the milligram per kg body weight according to the dose. So anesthesia is defined as attaining hypnosis, analgesia, reflex suppression with multiple pharmacological agents within the therapeutic dose. This is what anesthesia is all about. Now we'll go for the regional anesthesia. Okay, now we'll talk about the regional anesthesia. Regional anesthesia basically, you see, it blocks the pain in a specific regions of the body, just as the arms, legs, lower body. You may be awake or be sedated, but you will not have the pain. Hope you all understood what is anesthesia. Thanks a lot.
Today on this World Anesthesia Day, I will be talking on post-anesthesia care unit or the recovery unit, what to expect. Post-anesthesia care unit or the recovery room is a specially designed unit to look after the patients once they are shifted after the surgical procedure for immediate post-op care. This unit has staff who are specially trained to recognize and manage patients and their complications which may arise in the immediate post-op period while they care for the patient. It is supervised by an anesthetist who is readily available to help out if any emergency arises. The staff are also very well equipped with cardiac life support skills and to manage the immediate emergencies in the post-operative care unit. The patient, what do you expect when you come to the post-operative care unit? The nurse who will be looking after the patient will introduce herself and monitor certain important parameters which would help us to ensure that the patient is doing okay immediately after the surgery and while waking up from the anesthetic. So the heart rate, the BP, the respiratory rate, the saturation and urine output if there is a urinary catheter, the drains, if there's a drains put in for a specific surgical procedure, and temperature is continuously recorded every 15 minutes for the 1.5 to 2 hours of stay in the recovery room. Once the patient is fully awake, alert, conscious, obeying commands, pain-free, comfortable, and satisfies the criteria of the Aldrich score, which is the discharge criteria, which should be 9 on 10, after consulting the anesthesiologist, the nurse would organize transfer of the patient to the ward for further care.
I'm a part of the team that takes care of you during surgery. We take care of you before surgery, during surgery, and even after the surgery. We hold your hand from the beginning of this journey till the end of this journey. We work to reduce all the risks that you might face. So what are the risks that you can face? It can be something as simple as itching, sneezing or coughing when we give you a medication, or maybe you came in with a risk. We work towards reducing these. It can be something as drastic as a cardiac arrest, but we are there. We make sure none of these things happen and we take care of you. We make your journey comfortable, safe, and pain-free.
Today I am discussing with how to prepare the patient for a surgery and anesthesia. These are the very important steps before surgery. So basically, first you should identify the comorbidities, and the patient should be examined and physical examination to be done by anesthetist. So basically you have to identify the comorbidities. It will optimize the patient and it reduces the risk of complications in the surgery and post-op. So basically the comorbid conditions like diabetes, hypertension, renal failure and heart diseases can be identified preoperatively by evaluating with the patient's blood tests, ECG and other investigations. So basically the thorough pre-op anesthetic check decreases the complications rate in the post-operatively and intraoperatively. And one more thing, we have to patient should be discussed with the nil by mouth status. So basically the 6 hours will be for solids and liquids for 4 hours, and some centers will allow the clear liquids up to 2 hours. This will reduces the pulmonary complications and aspirations. And next thing is we have to discuss with the medications taken by the patients. So basically the long-standing comorbidities like diabetes, hypertensive can be discussed, and the associated complications can be discussed with the patients, and the drug medications to be altered according to the patients and according to the surgery. So next thing is patient should be educated well about the procedure and type of anesthesia, and some lifestyle modifications can be taught to the patient, especially the cessation of smoking, good hydration, good diet helps a lot during the procedure. And other things, the pulmonary functions can be improved by good thorough respiratory care. And next thing is patient should be advised with the pre-medications like anxiolytics, antiemetics, etc.
Today I would be discussing about how chronic medical illnesses can affect anesthesia and surgery. Now, what do I mean by chronic diseases? Today, a vast amount of population is suffering from chronic diseases like hypertension, diabetes, ischemic heart disease, asthma, obesity, and many more such diseases. Patients are on numerous medications for all these illnesses. When the patient comes for a surgical procedure, the first step is to be evaluated by the anesthesiologist in the preoperative period. Now, the main aim of this task is to identify the chronic diseases that the patients are suffering from, the medications they are on, and then formulating a plan of anesthesia which is unique for each patient. Sometimes the patients are also unaware of what medical illnesses they are suffering from, and they come to the anesthetist, and we help in identifying or detecting these illnesses and then treating them with the help of other specialist doctors. So by doing all this, we are offering a very safe anesthetic practice to the patient. What does a safe anesthetic practice mean? It means that we take into account all the chronic diseases the patients are suffering from, the medications that the patients are on, and we plan our anesthetic according to the patient's requirement and the surgical requirement. Sometimes we require extensive monitoring, special drugs, and special anesthetic techniques. All this done to generate a very safe pre-operative, perioperative and post-operative period for all the patients.
Neurosciences, Neuroanesthesia, Apollo Banerghatta Road Hospitals. Today I am going to talk about geriatric anesthesia, that is anesthetic management in the age group more than 65 years. These patients are special. As they age, their organ function will decline and they will have multiple comorbidities, and these patients will be on multiple medications. So they behave little differently from the younger age group. So we need to take some precautions when anesthetizing these patients. In the preoperative period, we need to do a thorough pre-anesthetic examination, take a note of all these comorbidities, various investigations to see the organ function. and also all the medications should be noted thoroughly. Intra period, the induction should be done in a graded manner. Drugs has to be given in a graded manner. Adequate hydration has to be maintained. Hypothermia has to be prevented and normal temperature has to be maintained. And we need to do monitoring also simultaneously. Post-operative period, we need to give attention on good hydration and good pain relief, early mobilization and prevention of dementia. To summarize, geriatric anesthesia has to be individualized with gentle care, and goal is smooth recovery and safe anesthetics.
Again, to wish everyone happy anesthesia day. Just think about that. If there is no anesthesia day or the people have not found out the anesthetics, surgery would have been very horrible. So this is what our anesthetists do. And not only that, anesthesia is a broad specialty. It's not only giving anesthesia, we take care of other things, intensive cares and emergencies, ICUs, and followed by, like, we are all now highly trained for super specialties like cardiac anesthesia, pediatric anesthesia, neuro anesthesia, and it goes on, and high risk anesthesia too. So again, once again, happy World Anesthesia Day to everyone. Take care, guys.
Happy World Anesthesia Day to all of you.
Wish you all happy World Anesthesia Day.
Wish you all a very happy World Anesthesia Day.
A very happy World Anesthesia Day to all.
Happy World Anesthesia Day.